As a veterinarian, every time I see a pet, whether it's for routine vaccinations or there's actually a serious problem they brought them in for, I always go from the tip of the nose to the tip of the tail because I want to make sure I don't miss something.
You make Garfield proud here, Precious.
66% of Americans are overweight or obese, and 50% of America's pets are overweight or obese. Fat cats and pudgy pooches are funny in cartoons, but in real life, it's debilitating to a pet's health and happiness.
There's a lot of you to love, Precious.
It's a serious medical condition. So if they have obesity, you're looking at an increased risk of diabetes, of heart disease, of joint disease, of cancer. And even in cats, you see problems with grooming, behavioral issues. So it's important to get them close to their ideal body weight. Don't feed free choice. You need to measure out the food exactly, so feed a precise portion control. Fewer of the high-calorie snacks that look like little ham bones and pieces of bacon, and more things like whole baby carrots and slices of apples, things like that. There's nothing like getting a dog out, getting them panting tired, employing games for your cats to get them to exercise. So a combination of feeding less of the right food, better snacking, and more exercise, and your pet will be at its ideal body weight.
He's got the bad breath going.
Oh, does he really?
See, he's already got a little bit of, see that little plaque and tartar on his teeth right there already?
85% of cats and dogs suffer from periodontal disease. It's the most common pet health problem. There's several things you can do to take care of your pet's teeth. The gold standard is daily brushing. If you have too much difficulty brushing, you can work with your veterinarian on some other options.
That's good.
It's like something that scrubs the plaque and tartar off the teeth. There are also some special diets available from your veterinarian, what we call edible toothbrushes.
Yeah, we'll get y'all fixed up, Pepper. What we're going to have to do is give you a little something and pull that one tooth and clean your teeth, and we'll get you on antibiotic.
One of the worst things when you have to give medication is not only do they read your body language, you feel guilty, you feel apprehensive, you may even feel terrified.
There's something I use called Greenie's pill pockets, which are nice. They're a little football-shaped thing that have a little cavity in there where you can insert the pill. So rather than, trying to get them up on a counter and prying their mouth open and stuff something down them they don't want, it's really a treat.
Well, as a veterinarian, what I like about pill pockets is, one, is it's something that is nutritionally balanced, so it's not going to upset their stomach. But I think the most important thing is you're actually going to be successful giving the medication.
It's a human food-grade product. And it's more like a treat than medications. Perfect. It's going to work perfect.
I give 3 pill pockets. So the first one is the tease. So I give the pill pocket, there's nothing in it. The second time we give the pill pocket, it has the medication. That's the deed. So we give the medication. The third time is the chaser. Again, no medication in it. It's important to talk to your veterinarian to kind of steer your pet's overall health, happiness, and longevity. For example, there's only one food that's best to feed every pet. You need to work with your veterinarian to find out what that food is. Remember, you need to exercise and get them panting tired every day. A tired pet is a happy pet. You want to give them preventive health care programs so that you're preventing problems rather than treating them. And when your pet is sick and needs medication, it's really important that you give all the medication as directed by the veterinarian. That's another reason why I like Greenie's pill pockets. It's going to be easy and delightful for you to give the medication that your veterinarian has asked you to do.